Okay, Appalachian Health, I'm sorry.
Andy.
I'm sorry, I apologize. Jumping the gun, yeah.
Morning.
Morning.
My name is Andy Blethyn, and I'm the Environmental Health Supervisor for the Appalachian District Health Department. We are currently dividing up duties, as normally you would see our Health Director, Jennifer Green, but she is in Ashe County updating their board of the coronavirus situation that we're currently experiencing. I've given you a couple of handouts, and at the first, the most recent numbers, now this was as of yesterday. The DHHS site updates every morning around 11 o'clock, so these numbers are probably going to go up. But as of yesterday, North Carolina had 32 confirmed cases of coronavirus, 0 deaths. Nationally, we are looking at 1,694 cases and approximately 41 deaths. But I'm sure when the state updates its website this morning in just a little bit, those numbers will probably change. So where are we now? Yesterday, Watauga County received its first presumptive positive. Now what this means is that a healthcare provider, either the local health department or a private healthcare provider, administered a test, sent it off, and it came back positive. The protocol is that the CDC, Centers for Disease Control, has to take those results and confirm it. Once they confirm it, then we have a confirmed case. We expect to get that back in the next day or so at a minimum. What Watauga County did yesterday was thus declare a state of emergency, primarily to start opening the doors for federal and state assistance, to get resources in through emergency management, financial aid and help for the community and for the organizations that are actively trying to prevent the spread. This morning in Watauga County, the health department has started testing. We have a drive-through clinic, and those people that meet the criteria, they have a fever, a cough, and respiratory illness, we're starting to see those, taking some samples and sending them off to the state lab in Raleigh for testing. In addition, the health department has instituted its incident command structure, its ICS structure. And this is basically a management control system that breaks our response down into different components such as command, control, logistics, operations, and finance. It's kind of a divide and conquer. We set up all these different areas so that no component is missed. And our staff have been setting up into that, and we are now actively in that system as part of our response. So the three main areas that we are currently looking at now are triage, surveillance, and isolation and quarantine. Triage is basically trying to figure out who is sick and who is not. We have a lot of the walking well that are calling in out of concern. Maybe they've got a slight sore throat, or they've got a fever. Maybe they just have developed seasonal allergies like I have. They're not sure. And so they're calling their healthcare providers and the health department, hey, I'm feeling this, do I need to come get tested? And so we are trying to triage those. If they have a medical need, a medical emergency, then of course 911 is called. If a physician or a nurse feels that they meet the criteria, then they would be instructed to come in either to the health department or their local provider to receive a test. Our number one goal right now in triage is to keep the emergency departments from being overrun with people that do not need to be there. As you heard, the hospital here has 6 beds. Those are going to be at a premium with people that need ventilators and ICU care. So our goal, working with local providers, is to keep as many people from showing up at the hospital and taking those limited resources. And we will continue to do that. Surveillance, once somebody comes in and we feel that they need to be tested, then they are administered the test and they are asked to self-isolate, meaning, Jerome, if you came in and we administered the coronavirus test to you, your doctor, nurse would ask you to just go home and keep yourself in front of the TV while we're waiting for the test results. If you meet those criteria that require you to be tested, then we have to assume that you may have it, and we don't want you to be out in the community further spreading it around. So just because somebody has been asked to self-isolate does not mean they have it. It's preventative measure to try to stop potential spread. As I said earlier, a presumptive positive, if that test comes back, and let's say it says that you have the COVID-19, then that will be sent to the CDC for confirmation. So it's double confirmation. We're not going to go by one test. Not all tests are accurate. Sometimes you get bad testing kits. So we want to make sure before we take it to the next level that you actually have this disease and then need to be quarantined. In addition, we also start what's called contact tracing. So if, for instance, you had it, we would then start talking with you about where you've been and who you've seen. Have you been on an airplane? Have you been, who lives in your household? Who have you come in close contact with, less than 6 feet, for more than 10 minutes over the last week or two? Because that's how we're going to try to figure out who we need to start contacting as far as they may potentially have contracted the virus as well. So this contact tracing is a very important epidemiological tool that we have to try to work back in time to figure out who somebody with this disease, this virus, may have come into contact to, so we can thus contact them and be prepared for them to also become ill. Finally, isolation and quarantine. So if a presumptive positive is confirmed by the CDC and you in fact have the COVID-19 virus, then the local health director will issue you an isolation and quarantine order. This is a legal document that is enforceable through the court systems, to where you are specifically quarantined, typically to your residence, and for a period of time to where you get over the symptoms and you have 2 negative tests confirming that you are no longer infected. The contacts, your close family, or if you've been around coworkers for an amount of time or on a plane, we do that contact tracing. If we find there are people that meet the criteria and they have been tested, then typically they would be quarantined with you. So you might see families getting to get to know each other quite well. But while anybody's in quarantine, we have a lot of mechanisms in place to support them. They will be in close contact with healthcare providers, nurses, doctors, and physicians that will be routinely checking in. How are your symptoms? Are they getting better? Are they getting worse? Are you presenting new symptoms? So that we can stay on top of their medical condition. In addition, a health department liaison will be contacting them regularly to see what their needs are. Some people, they maybe have extended family that can bring them food and medicine and supplies. For those that do not, we will be working with emergency management, with other community partners such as churches and other social organizations, and health department staff to make sure they receive what they need to survive through in the day. Food, medical needs, especially medicines if they are on those, and any other type of supplies, hygienic products, clothes, things of that nature. I believe I also noted that it takes 2 negative tests. So when a test is sent off, it takes approximately 36 to 48 hours. So it can take a while to get those 2 positives and 2 negatives, and it's important that anybody in that process remains isolated and quarantined from other people, and that is how we're going to stop the spread of this disease, is to slow its ability to infect new hosts. Reiterate, we're working throughout all our 3 counties with all our partners, commissioners, emergency management, law enforcement, other organizations, to try to get on top of this as best we can. The second sheet I gave you is just some general information regarding how it's transmitted, what you can do to protect yourself, what are the signs and symptoms. It is critical from a public health standpoint that we get the correct information out to the public consistently and continually. And this is where this board and other organizations can work with public health and local providers to get the right information out. Facebook, as we all know, started a little scare last week. This is where we can step up, and you hear this in the community, and say, well, you know, I was at the state website, or I was on the AppHealthCare website, or we just had a presentation, and here is where we really are. Getting that information out is going to be critical, and I'm open for any questions you gentlemen may have.
Go ahead, Larry.
Is it possible that you could force or require the hospital to expand and open more rooms it needs?
I am not aware of, that is definitely a legal question. Then you also run into the capability of any medical facility to open rooms and have them properly equipped to receive a patient as I'm sure the hospital can tell you, will be a tall order. Ventilators are in short supply. And
So staffing.
Yep, and staffing. So there are a lot of, things that can and can't be done effectively at this point.
One question for Ricky. Are the 6 beds separate rooms, or are some of them 2 to a room, all separate? So you could quarantine somebody if you had to? Okay. Then for Andy, the person that may have the COVID-19 did a lot of traveling. And more than likely, I mean, I don't know the travel history, but that person more than likely got it traveling. We don't, do we know where they traveled from, or?
The case in Watauga was travel acquired. We do know that.
At one time, Appalachian had quite a few students that were overseas, several in China, but they've all shown no signs.
I'm not aware of that information. We have a number of persons under investigation, PUI. We have been instructed by the state that we don't discuss those individual cases because we don't want to give out false information. We don't want to stir up fear that is unnecessary. And most importantly, we have to protect that patient's rights to privacy.
And now with the health department having to focus on the virus, some of your other programs sort of get pushed to the side a little bit because of
Yes, sir.
staffing.
Yes, sir. So our clinic staff are now completely focused on our response, and that would be primarily for the triage and the surveillance. We have pulled in other staff for our community health resources and staff to help man the phones, get information out. Environmental health staff, right now, we've got a couple key, myself and Monica McKinney have kind of stepped up into the ICS. We have designated other staff to try to keep our environmental services going as long as we can, primarily food sanitation inspections, which also encares our residential care facilities, child care facilities, our public schools, and then water protection, which is permitting of septic and wells. We're doing all we can to keep our core programs going because they are every bit as important to public health as a response to a communicable disease outbreak. But as this develops, and as I'm afraid it will get bigger, we will have to pull our staff more and more into this COVID-19 response, which will put other programs from community health to environmental health and dental on the back burner.
I think that one of the things that the health department does, a lot of people are trained in other fields. I mean, your specialty is one water, sewer, septics, but you're also trained to be able to help in situations like this.
That is correct. A lot of our staff are cross-trained. Environmental staff hold different authorizations. So, for instance, I'm authorized in wells, septics, tattoos, swimming pools, food and lodging institution inspections. So a lot of our staff have at least 2 to 3 authorizations. We can pull them within environmental health. And as far as the district goes, you know, this is another point to be made, is that as a 3-county district, environmental staff and all our staff work in all 3 counties. So I'm an authorized agent of the state, as is my field staff. I can pull them to what other county as needed for whatever reason. And we've been doing that effectively since I've been supervisor in '07, so that if we've got an uptick in Allegheny County in septic permits, I can bring staff over during the week or overtime to meet those needs, vice versa. So yes, our entire health department is you know, you wear many hats, and now we're getting to put them all on.
One thing, when you send somebody to test somebody for the virus, it's not one person goes, the way I understand it. Is it 2 people that go?
So what the
Work through that process, how they have to check off, you know, one person's doing the test, another person is checking.
Yes, sir.
To be sure everything is done in a certain order.
Right. So right now, as far as if you're going to get tested by the health department, our first goal is to get you to come to our facility. We have an area in the parking lot that's been set up with emergency management in Watauga that is under a canopy tent, to where we have a controlled environment as well as we can with the rain primarily. We want to keep anybody that's potentially infected outside of the building. We do not want to get that into where our staff are and where any other members of the public that may be taking advantage of programs that we can still provide. So when we arrange for them to come to our facility at a given time. It's just, you know, it's not like our rabies clinic where you drive up with all your dogs and you wait your turn. We have appointment times. So then when you arrive, 2 of our staff, one nurse, our 3-county health department has 9 nurses for all 3 counties. So they're working real hard. So one nurse is there to administer the test. Now, they are completely donned in the suits that you see, and the N95 respirators, and the goggles, and a face shield, double gloves. They are suited up to become up close and personal with somebody that potentially has this, because the test is administered nasally, and you can also do it down into your mouth and throat, which can elicit a pretty nice cough. So they are suited up and as well protected as they can be for being right next to this potentially infected person. We have a second staff that currently we are using, environmental health staff. They do not have to be suited up. They can be as far away as I am to Michael and Drew to watch them administer the test and make sure that they have they have donned their protective equipment properly, follow a check sheet, and then as they administer the test, which only takes a couple seconds, you're talking a couple swabs, and then that person is gone. But then they have to they have to take it all off in a systematic way so that they are not potentially infecting themselves. So the second staff is there to basically go over the check sheet one at a time. The nurses are well versed in this. They've done it a million times, but that safety factor, you know, is in place because it takes one misstep, one thinking about something else, and we could lose one of those 9 nurses, and we can't afford that. So that would be probably the standard protocol at most facilities that you would see.
Thank you.
Sir, I wanted to ask you about, you mentioned the people that's positive and they're at home, and you all are going back and forth. Do the doctors actually go out to the house if that's needed to check on that patient and
Right.
go in, or?
Well, if so, as the patient is receiving their medical monitoring, you know, they've got a nurse or a doctor that's checking in. If their conditions change, you know, then that physician, that nurse makes a judgment call. It may be that they need to get EMS out there and get them to the hospital because now they're in full respiratory, you know, that they need that kind of care. It may be that they just need a checkup, but that would be assessed, and then yes, the patients would probably be seen at their facility with the healthcare providers being in full protective gear, limit their, you know, being affected as well.
Does each county have this outside facility set up at their health department, or explain that a little bit?
So we are currently active with Watauga Emergency Management, and we created this ICS with them. They came and set that up for us. So as the need progresses, we've already been in contact with Daniel, and I'm sure those are ongoing with our ICS coordinator, Jennifer Tayson. And if it becomes necessary, then we would look at partnering with the county and your emergency management to get those assets and get them in place and then get it up and running.
I am assuming, and we know what that does, but I am assuming that you go ICS once you have a positive case.
We went ICS last Wednesday, was when we started gearing up for it. We had several people under investigation. We could not, as you said, just assume that they would be fine. So we geared up last Wednesday and have been in preparation for yesterday's.
It wasn't spontaneous, you had valid reason to,
Yes, sir.
to start that protocol.
That is
Thank you.
correct.
Other questions?
Just one little question I hate
Sir.
to ask. How is this going to affect your overall budget? Because you're having to suspend some services that you make money on, that you collect revenue.
Right. So
Plus, you're going to need more material, I would assume.
Right. So a lot of the materials that we need for the response, Watauga County Emergency Management is actually going to 2 off-site facilities to get a lot of the personal protective gear that we need, our PPEs, and get those up to us through the ICS system. So a lot of these costs in that regard are not going to come directly to us. Now, we are having to divert staff. We're having to work a lot of overtime. I was at the state lab in Raleigh yesterday morning at 8 a.m. to get test kits, bring them all the way back because we didn't feel we could wait until Monday for the state courier system to take that. So there is a lot of staff time and money that will have to be used for overtime, buying additional supplies that a lot of those we can hopefully get reimbursed through the federal government and the state. But yes, it will take time and money out of our budget and our staff's.
Mr. Chairman, I believe we can anticipate, based on the action of Congress over the weekend with the money that was allocated, that those funds will start flowing in also.
We have in our ICS system, we have a finance department, and that's what they're already on. Our staff are tracking all their time and activities in any type of supplies that directly cost the Appalachian District. And so we will be tracking those, monitoring them, and yes, sir, we will be making requests for reimbursement as we can get it.
I guess my big question is, do you feel we have adequate supplies of test kits?
Well, the test kits, as we've all heard on the national news, were a little slow in coming. And part of the problem is this is a new virus. We've not run into this family member of the COVID family yet. So it has to be developed. And then you have to gear up to have those numbers. What we respond to, this could have been an Ebola outbreak. Totally different testing needs for that. I do believe that with recent actions at the federal level to get more private companies producing the tests and getting them to market, we are getting them in more quantity. The way we are currently set up is that as we need them, we get more. They're just not going to send 2,000 to Allegheny County unless we need 2,000. And that is, to kind of the opposite of the toilet paper run is we want to manage this as needed. But as we use them, we will get more.
Supply is there.
We've been told that as we need them, they will continue to send them. But they need to keep their assets to, it's ever changing. You don't want to send us a bunch and then they actually need to go down to Halifax County at the coast. So it's more of a logistics.
Any other questions?
Thank you very much.
Thank you.
One more question.
Sir.
Would it be possible to get you back once a month for an update?
You let me know, and I'll be happy to do whatever you would request.
It'll be
Yes,
good, I believe, the current time, we work our way through this thing to have that
Sir,
coming from you guys, and
we'd be happy to. We're here. We may not be a county agency, but we are your health department.
Right.
I'm a citizen of this county. These are my neighbors, and anything I can do to help keep them safe, you just say the word, and we're here.
certainly sounds like your group is on top of this thing. We
Doing the
appreciate you.
best we can.
We appreciate you coming.
Thank you. Appreciate your time.